So thank you, Dr. Nakatsuji, for giving me this opportunity. And also, I would like to thank the invited guest for coming all the way to Kyoto. Today, I'm going to talk about cell transplantation for the treatment of Parkinson's disease patients. But unfortunately, this is not a clinical report, but the struggles toward it. And so, thanks to the Professor Brundin, I can skip this introduction. So, this is a strategy for the cell replacement therapy for the Parkinson's disease by using ES cells. The first step is neuronal differentiation. I mean, the neurons or neural stem cells, neural precursor cells, are induced from the ES cells. Then the cells are transplanted into the brain to let the cells survive and differentiate and function as the neurons in the brain. So to obtain optimal conditions, we are trying to find good conditions, or trying to find developing a method by using mouse cells or mouse brains. So let me introduce some of them. So these are the keys to a successful transplantation by using ES cells. There are so many problems or so many checkpoints to be solved, but one of them is efficient induction of neurons from ES cells. The method to induce dopaminergic neurons, the method we use is SDIA, stromal cell-derived inducing activity method. So in this method, we use PA6 stromal feeder cells, which is derived from mouse skull barrier, mouse skull bone. So when we co-culture ES cells with PA6 cells, they proliferate and they differentiate in neurons in about 2 weeks. So I hope you can see the neurites extending from the colonies of ES cells on the PA6 cells. And the immunofluorescence study shows that there are Th-positive cells included in the colony in extending neurites. Th stands for the tyrosine hydroxylase, which is the important enzyme to produce dopamine. So that means that Th is a representative marker for dopaminergic neurons. So to obtain the graftable cell populations, we modified the original SDIA method. In about 8 days, ES cells differentiate into neural precursor cells or midbrain progenitors on the PA6 cells. If you continue the culture on PA6 cells, in about 2 weeks, these cells become mature post-mitotic dopaminergic neurons expressing Neu1 or Th. But we detach the colonies from this point and continue the culture as floating neurosphere cultures. If you culture these neurospheres without serum and with FGF2, these immature precursors expand as immature neural stem cells. But if you add conditioned medium of the PA6 cells, these cells a little bit differentiate into towards the differentiation, and these neurospheres contains a lot of dopaminergic neuron progenitors which express engrade 1 or 2. And if you inject these cells into the mouse brain, these cells survive and differentiate into the mature dopaminergic neuron expressing dopamine transporters and another enzyme, AADC. So we compare efficacy or the producing dopaminergic neurons in vivo at each stage of the differentiation. So in this time course, these cells is at this stage, so they are too immature. So if we grafted these cells into the brain, these cells survives in the brain, but we can find only in a few Th positive cells. And these cells are post-mitotic, very mature neurons like this. So we grafted these cells into the striatum. The Th positive cell survives in the brain, but when we grafted these progenitors enriched neurospheres into the brain, so we observed that a lot of more Th positive cell extending neurites into the host brain. So for the optimal graft donors, we suppose that these proliferating dopaminergic neuron progenitors will be better than these more immature or mature cells. But here is a problem, because they are not, they are proliferating. So there is another problem of the tumor formation. Actually, we encountered these tumors in the brain in about 1/3 or a half of the mice 6 weeks after transplantation. So what is the cause of the tumor formation? So by immunofluorescence study for Ki67, we can detect the rapidly proliferating cell in the graft. And this staining is overlapped with E-carboherin or SSEA1 or OCT4 staining. So these markers are that of the undifferentiated ES cells. On the other hand, the staining for E-carboherin never overlapped with the staining for MOSASH1, which is the marker for the neural stem cell, neural precursor cells. So that means the cause to the tumor formation was caused by the contaminated undifferentiated ES cells. So to confirm this hypothesis, we use the SOX1 GFP knocking ES cells, which was given by Dr. Austin Smith. So SOX1 is the first expressed neural cell marker. So when differentiated in about 4 or 8 days, some of the cells express GFP. That means these cells are committed into the neural lineage. So in our experiments, naive ES cells didn't express SOX1, but for 4 days of SDAA treatment, these cells expressed SOX1, a messenger RNA detected by RT-PCR. At that point, immunofluorescence study shows that 6% of the cells express GFP, and the rest of the cells expressed OCT4. That means these cells are still in a stage of undifferentiated ES cells. But these two populations never overlapped. So we divided these two populations by FACS. So the GFP positive cells, of course, expressed SOX1, but GFP negative cells didn't. But these GFP negative cells expressed ES cell markers such as OCT4, NANOG, and ERAS. Then we grafted these two populations into the normal mice brain. So when we transplanted GFP negative cells into the normal mouse striatum, the cells frequently formed these tumors, and the histological examination shows these cells are teratoma-like. But again, the GFP positive cells never formed tumors. And these cells also expressed TUJ1, which is the neural cell markers. So that means these cells survived and differentiated into neurons without forming any tumors. So this tumorigenicity was confirmed by subcutaneous injection into the SCID mice. Again, GFP positive cells never formed tumors, but GFP negative cells formed teratomas like control EL cells. So that means we can avoid tumor formation by selecting only neural lineage cells. So these results tells us that an optimal graft should contain a large amount of dopaminergic neuron progenitors, but no ES-like cells. So we are now, and we and other groups are developing a method to select or purify these cells to avoid tumor formation and to obtain more effective cell survival. But if you can get optimal donor cells, even if you can get optimal cells, you have to think about the method of transplantation or the methods to alter the host environment, because it is reported that about 90% of apoptosis occurs during the first 4 days post-implantation. And the triggers of these acute apoptosis during transplantation is suggested, such as the direct damage during the cell preparation and injection, or trophic factor withdrawal and acute inflammation. Actually, the cell dissociation itself triggers apoptosis, and which has the special name, anolysis. So the apoptotic cells can be detected by tunnel staining, and as shown here, after 12 or 24 hours after cell dissociation, the number of tunnel positive cells increased. So the dissociation is reported that that dissociation disrupts the signals from integrin. So we checked the effect of the cell dissociation on the raw ROCK pathway by modulating by these inhibitors. And these are ES cell-derived neurospheres, and the cells express the ROCK1 and ROCK2. And by treatment with the ROCK inhibitors, the number of tunnel positive cells decreased. And also, the ROCK inhibitor treatment also decreased the number of the cells with blebbing. Blebbing is a morphological change observed in the very initial stage of the apoptosis. So that means the ROCK inhibitor can reduce the number of apoptosis during the cell transplantation or preparing the cell transplantation. So we use the ROCK inhibitor before the cell transplantation. I mean, we add ROCK inhibitor 6 hours prior to cell dissociation, and we grafted the cells with ROCK inhibitors. After 2 days, we performed the tunnel staining of the graft. So as shown here, the number of tunnel positive cells decreased with ROCK inhibitor treatment. So, and we are thinking another explanation for this decrease, that is when the cells are injected by needles, the acute inflammation occurs around the graft, and which results in the secretion or accumulation of the TNF alpha or pro-NGF such cytotoxic cytokines. So these cytokines stimulate the membrane-bound receptors such as P75 or TNF receptors, which stimulate low ROCK pathways. So another explanation for this decrease can be the ROCK inhibitor suppress these processes. Anyway, so we hope the ROCK inhibitor helps to reduce the apoptosis during the cell transplantation. And we also have to think about the immunological reactions by the host brain. This is the pictures 8 weeks after allogenic graft in the mouse brain. So as you can see, without immunosuppression, without cyclosporine treatment, the number of CD45 positive leukocytes or F480 positive microglia or macrophages or CD8 positive cytotoxic T cells accumulating or invading into the graft. And by the treatment of the cyclosporine, these accumulating cells are reduced. But interestingly, the volume, the graft volume, the size of the graft did not differ irrespective of the use of the cyclosporine. But if you look at closely, the number of the GFAP positive astrocytes or number of the TUJ1 or neuron positive neurons are different. If you add cyclosporine, the number of neuron positive neurons increases, but the number of GFAP positive astrocytes decreases. So that suggests that the immunological reaction suppressed neuronal differentiation from the ES cell-derived precursor cells in vivo. So that means the suppression of the immunological reactions or inflammation is important not only for the cell survival, but also for the neuronal differentiation. So this is a simplified picture of the cytokines secreted by these cells. But anyway, so the accumulating cells, accumulating microglia or cytotoxic cells secrete cytokines such as interleukins or TNF-alpha or interferon gamma. So we add these cytokines into the culture medium during the in vitro differentiation. And we found that only interleukin-6 increase the number of the GFAP positive cells and decrease the number of neuron positive, TUJ1 positive neurons. And the antibody, the addition of antibodies reverse this effect. So this result suggests that the IL-6 suppresses neuronal differentiation of ES cell-derived neural precursor cells. So now we are thinking about the suppression of the IL-6 after the cell transplantation. So these struggles or efforts we are making towards the clinical application of ES cells, but we are humans, and I mean the primates. So we have to think about the primate model. So we also perform the experiments with primate model and primate cells. So in this case, we use the monkey ES cells. So we induced the dopaminergic neurons by SDIA method, and we cultured the neural spheres and expanded by using the FGF2 and the FGF20. So now so we got the progenitors of dopaminergic neurons. For the monkey models, we injected the MPTP, which is the toxic drugs which selectively kills dopaminergic neurons. And after that, so we transplanted these cells into the putamen of both sides. After that, we performed the behavior evaluation and PET study and immunofluorescence study. So by using the combination of FGF2 and FGF20, we get about 25% of the TUJ positive neurons were TH positive dopaminergic neurons, and like this. And these cells also expressed messenger RNA for PTX3 or NU1, and also they secrete dopamine into the culture medium in response to the high potassium stimulus. So that means these cells are mature midbrain functional dopaminergic neurons. And for the monkey models, we use the neurological scores which resemble to the clinical patients. So the point 0 is a normal monkey. So after injection of MPTP, the scores or neurological status worsen. And we use the monkey with stable scores for 3 months because we are afraid of the spontaneous improvement. So we observed the 3 months, and the monkey with the stable scores we used for the experiment, for the next experiment. At that point, immunofluorescence study shows that the number of dopaminergic neuron terminals in the striatum is much decreased in the MPTP treated monkey. This is the normal control monkey. And for each monkey, we took a picture of the MR imaging and transplantation stereotoxically. This is the outcome, the results of the change of the neurological scores. This is the ESL transplanted monkeys and the sham-operated monkeys. So about in 3 months, the neurological scores improved significantly compared to the sham-operated monkeys. At that point, we performed the PET study for fluorodopa. This is the normal monkey, and this is the sham-operated monkey with a medium only. So these are ESLs, these are the monkeys with ESL transplanted. And that means this hot point shows that the grafted cells survived and functioned as dopaminergic neurons in the brain. And after that, we sacrificed the monkeys and the immunostain, the brain slices. Before transplantation, we labeled the EL cells with BRDU, and we could find the TH positive or dopamine transporter positive cells. And some of cells we co-localize with the BRDU and TH or BRDU and DAT are co-localized. That means that the grafted cells survived and differentiated in the brain as the dopaminergic neurons. So this is a summary of the monkey experiment. The survival rate was very low, so we have to seriously think about the method to improve this. And the number of Th positive cells are a little bit more than 2,000 cells per site. There are a lot of clinical data that Professor Brundin showed. The presented or proposed number of Th positive cells needed for clinical neurological improvement was 25 to 100,000 cells per site. As the volume rate is 10 to 1 between human and monkeys, synonymous monkeys, is 10 to 1. So as a simple analogy, it comes to the Th positive cell needed for monkeys is about 2,500 or 10,000 cells per site. So our results are a little bit smaller than this. But if you think about it, these are real progressive human patients, but these are drug-induced monkey model. So if you think about that, I think this is reasonable, within the range of the reasonable points. And also the neurological scores in our experiment, the scores improved in 3 months. And it is reported by the double-blind clinical trials by Dr. Fried. The patients with the UPDRS motor score improved in 4 months. That is also similar. So that means the ES cells are not very superior to the fetal cells, but I think we can expect the ES cell to be a substitute of the fetal cells graft. So the last part is the human ES cells. At the end of the last year, I could find 10 papers regarding the induction of dopamine neurons from the human ear cells. And this paper says that we can induce dopaminergic neurons from different cell lines from the different countries. So that means it is true that the dopaminergic neurons can be generated by human ear cells. And what is the function? There are 5 papers in which the cells are grafted and motor behavior analyzed. Out of 5 papers, the 3 papers mentioned that the motor function was improved. But if you look more closely, in the papers failed to motor improvement, there are only few or 10 to 50 cells, only a few Th positive cells survive. So, roughly speaking, if you succeed to get a lot of Th positive cells in the brain, so we can expect the motor function improvement by the cell transplantation. And also, we have to very seriously notice or cautious about the tumor formation. Even it is a xenograft from human to mouse, the 3 papers reported that the tumor formation. So we have to think about this, and we have to prevent this. And in Japan, human ear cell lines are established in Kyoto University by Professor Nakatsuji and Dr. Suemori. And we have 3 lines. By every 3 lines, we can induce dopaminergic neurons by SDIA method. And these cells also secrete dopamine into the culture medium. So now, PA6 cells used in the SDIA method is originated from mouse. So we cannot use that mouse cells. So now we are developing the SDIA method without mouse cells. So, and I hope in the future, so we can apply this method to the clinical patient. So this is the last slide. So now, so we have succeeded this, roughly speaking, so we succeeded in the monkey model examination. But so for clinical application, so we have to use the human ear cells, but it is proved by a lot of laboratories. And also, so we have to develop the induction method with feederless or a gene-free method, and also to prevent the tumor formation. So we have to select or purify neuronal cells or dopaminergic neuron progenitors. And also, at the transplantation, we have to prevent the acute apoptosis by using the drug or sophisticated method for injection. Or we have to think about the host environment. I mean, the immunosuppression, the sophisticated immunosuppression. And afterward, so in the previous study, so we only observed the short term. So in next step, so we have to follow up for long term, more than 1 year, to confirm the safety and effectiveness of this experiment. These are collaborators. So the main collaborators of me is the member of the neurosurgical department. So every year, my colleagues consist of 6 men, unfortunately girls. But when we studied the monkey surgery in 2002, the building and clothes are very old, but now they are renewed, and we are doing very comfortable. And for the ear cells, we are helped by the Dr. Suemori and Nakatsuji, and for the neural induction, we are helped by Dr. Sasai at Kobe. And also the PET study, so we get the help from the Dr. Hayashi and Ida at Osaka. Thank you very much for attention.